Okay, so I'm going to give an update on the iSCAD Registry. And the iSCAD Registry is funded by the patient organization SCAD Alliance. The table for SCAD Alliance is up at the front. And Catherine Leon will be speaking right after me. But similar to the FMD registry, we have a registry for patients who have suffered a SCAD heart attack, whether or not they have fibromuscular dysplasia. And our mission is to develop and maintain an independent quality data repository to advance the pace and breadth of SCAD research around the world toward the common goals of improving patient diagnosis and outcomes and accelerating scientific discovery. I am the international chair of the steering committee and the principal investigator. The steering committee is also comprised of Catherine Leon, our patient representative, and also the executive director of SCAD Alliance, Dr. Melissa Wood, Dr. Sahar Naderi, Dr. Nandita Scott, and then Dr. Mike Gibson, who runs our coordinating center, Perfuse. We have 29 enrolling sites across the country, and our goal really is to include all different types of patients, because we know that FMD and SCAD is not a disease just of middle-aged white women, but Black women can be affected, Asian women can be affected, men can be affected. Elderly people can be diagnosed, young people can be diagnosed. So we really want to try to capture both community-based and tertiary hospitals to give the best data. We started our enrollment in March of 2019, and since then, as of July 31st, we've enrolled 2,155 patients, which is an incredible number, and I think we might be the largest registry in the world now of SCAD. So thank you to any of the patients who may be here and are participating in the iSCAD registry. You're really helping to advance the research. What makes this registry so unique? Number one, the I in iSCAD stands, one of the I's is independent. No one institution owns the registry. So it's not the Sanger registry for SCAD or the Vanderbilt registry for SCAD, it's the independent registry for SCAD. And the data is actually owned by SCAD Alliance, the patient organization. And so patients really have autonomy in owning their own data. It's decentralized, meaning that the data is housed in at the Beth Israel Deaconess Medical Center, where they're not enrolling patients. They are purely keeping the data. They're stewards of the data. They help us analyze the data, make sure it's clean, et cetera. The patient voice, when we made the registry, we actually asked patients to test it for clarity, for the right questions being asked, and for length, because we know there's a lot of questions. And so we want to make sure to respect everyone's time. The I also stands for innovation. We have developed a multidisciplinary group of physicians. SCAD is complex. You need cardiologists, you need vascular specialists, you need surgeons, you need neurologists. It's like FMD. It's all of the things that we need. We wanted diversity and also equity. You shouldn't have to be wealthy living next to a tertiary center in order to get the appropriate care. And so right now, uncommon diseases, you have to travel a long way to even be educated about the disease. But our dream is that one day all cardiologists and vascular specialists will know how to treat FMD and know how to treat SCAD, at least recognize it and refer on. So that is our goal. We are really proud of our patient involvement in the iSCAD registry. And in fact, for our major articles, we actually have asked patients to write a piece of the journal article. So this is our article. I think this is the one on migraine headaches, or it might be the one on PTSD, but we had a patient write a patient perspective, and we included it right into the manuscript so that doctors could know exactly what you're experiencing and remember why it's so important to do the research. And then we always acknowledge the role the patients play in the registry. I should say that the registry is funded solely by SCAD Alliance, solely by the patient organization, solely from donations to the patient organizations. And with that, we are able to fund the coordinating center that helps us to come up with all of these abstracts and presentations. So in the short time that we've been a registry, we've actually been very productive. We actually have, I just found out last night, there's another abstract that was accepted. So we have 2 abstracts we'll be presenting at the American Heart Association. So up to now, we have 13 abstracts and presentations. One of our goals, we know that patients paid the money to do the research by the donations. Patients fill out the forms. patients live with the disease. And so patients should be able to read the results of the research. So it's really important to us to make every single publication from the iSCAD registry open access. That means you should be able to go onto the internet, type in the title of this paper, and be able to print it out, take it to your doctor, read it, share it with your family, whatever. But please know that it costs anywhere from $3,000 to $6,000 to publish a paper and make it open access. And so this is really why it's so important, if you are passionate about the cause, to support organizations like SCAD Alliance, FMDSA. Our first paper was actually first authored by a psychologist, Dr. Jennifer Sumner, and it was on PTSD after SCAD. I don't think I need to tell you that there's a lot of PTSD after SCAD. I also don't think I need to tell you that most doctors do not screen for it and patients are not being treated for it. So if you are a patient who's had SCAD and you have symptoms of PTSD, please do notify your physicians so that you can get appropriate care for this. We know that there is a strong brain heart connection. And when your brain is not right, your heart's not going to feel right either. So very important to acknowledge that. Our next paper was written by Dr. Wells, also open access, looking at migraine headaches in patients with SCAD. Similar to FMD, the prevalence of migraines in SCAD patients is high. 46% of patients with SCAD said they had a history of migraines. And about a quarter of them had moderate to severe disability from that, meaning it impacted the way they were able to live their lives, go to their jobs, take care of their families. And surprisingly, a third of patients were on triptan medications, even though they had had a SCAD heart attack. So we still need to get some education out there on medications that are safe and those which may not be so safe. Our most recent publication, also open access, was written by Dr. Stan Hankin, and he did this work while he was at Dartmouth, which is a site for the iSCAD registry, looking at what factors are associated with persistent LV dysfunction. And that just means a weakened heart muscle after a heart attack. And can we identify some risk factors for having a continued weakened heart muscle? So we looked at patients who had assessment of their heart function before the period that is recommended to have a repeat echo. So when you have a heart attack, everyone should get an echo. We all that's just part of the workup of a heart attack and chest pain. And then everyone who's had a heart attack really should have another echo within about 3 months. If it's normal when you're having a heart attack, you may not get an echo. That's okay. But if you had any abnormality at all in terms of your heart muscle, in 3 months, you should have a repeat assessment so that we can tell if you have improved or not. And it turns out only 1/3 of patients with SCAD had a repeat echocardiogram performed. And so cardiologists are not doing the basic MI care that other patients with heart attacks not from SCAD may be getting. Turns out only half of patients had guideline-directed medical therapy, the medications that we use for weakened heart muscle. The factors that were associated with continued weakened heart muscle, even after the 3 months time, or even after many, many months, up to a year, were STEMI, so a certain type of very severe heart attack. Those are presented with shock, those who started off with the lower baseline heart function at the time of their heart attack, and then those who had their heart attack during pregnancy. So we are starting to identify some folks who may have a higher risk picture from the research. Just to give you an example of some of the things that are coming down the pike, we have 3 manuscripts in submission. We're looking at something called Takotsubo syndrome, which is stress cardiomyopathy. It's when the heart becomes weakened after something very stressful happens. And normally it happens with a normal angiogram, but we're seeing that patients are having what looks like Takotsubo cardiomyopathy and a SCAD heart attack at the same time. And so it's interesting that both entities affect women disproportionately as well. So maybe, again, something with the mind and stress hormones. We're looking at sex differences in the iSCAD registry, and that's in resubmission, so hopefully published soon. Are there big differences between men and women who have SCAD? And then factors associated with a complicated hospital course. So who goes on to have cardiogenic shock? Who goes on to have repeat cath? Who has a longer hospitalization? And then we have several that are in the line waiting. And similar to the FMD day that we have here, we've had some specialized days for patients who've suffered a SCAD heart attack. As you can imagine, patients who've had a SCAD heart attack also require a lot of support and community. So we're really proud to have hosted 2 of those conferences here. One of the results of the conference, the first conference, we had 30 external faculty from all around the country come and speak on SCAD to patients and to other doctors. And one of the outcomes of this was this review article that we were able to publish in one of the great journals in cardiology. And you'll note that there are 2 patients and patient representatives on the paper. So it's really important to us to maintain that relationship with our patients who we know are the ones that need these papers written, but to also understand what are the important questions you're asking, because there are questions we're asking, but that might not be as important to you in your day-to-day. So we need to work together. Just to show you faces and pictures of other doctors who are passionate about helping patients such as yourselves with uncommon disorders. These are the faculty members who came to the second SCAD conference, and we broke up into groups and we brainstormed what are the big research questions that are coming down the line. How do we make the registry a living registry by making sure the questions are up to date. So right now in the registry, we're actually revamping all of our forms and questionnaires. We're brainstorming ways that we can work with other researchers outside of the registry to try to make advances in genetics, et cetera. So in summary, the iSCAD registry is a patient-initiated, patient-supported registry. New data is definitely coming. I've shown you all of the papers that are in progress. I want to thank all of the patients and family members who have contributed to the research, either through your contributions financially or of yourselves by completing the questionnaires, et cetera. I wanted to let you know, I don't know if Catherine may be touching on this, but we have a dedicated YouTube channel for anyone who has been affected by SCAD, where we've had webinars during the pandemic and beyond. And so there are lots of videos on there with various experts from around the world, really kind of answering questions on various topics related to SCAD. So that's my last slide. Thank you very much.